Have you been scared by a doctor? Hey folks, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas, and I'm coming to you today to talk about getting scared by healthcare practitioners. What's healthy about that and what's not healthy about it? Now I want to begin by saying there are two kinds of scares in the healthcare industry. There are the good kind of scares and they're the bad kind of scares. Now let me explain that a little further. Let's begin with the good kind of healthcare scares, okay? I believe everyone can admit that there have been times in their lives that they needed a wake-up call. For example, there are people that have they've missed gym day for 20 years or more now, all in a row. And somehow they forgot to watch their Weight Watchers points as well. Like at all, they forgot completely. What was a comfortable waistline balloons up to a very uncomfortable daily struggle. A lot of us can identify. It's not like these people don't realize there could be a developing issue. They know this, but sometimes, in order to snap somebody out of it, a healthcare practitioner may choose to spook the patient a little bit. For example, you may hear a doctor say something like, "It's not a matter of if you develop diabetes, it's a matter of when you develop diabetes. And when you do develop diabetes, and you will, here is exactly what your life is going to look like, and you're not going to be happy about any of it." Right? Most understand this sort of communication is going to be much more effective than something like, "You know, Mrs. Jones, I know you enjoy your cake and your hamburgers, and I know you enjoy your couch that has formed to the shape of your hiney. But it sure would help your health if you get up a little more often and move a little more often," right? So that sort of communication is going literally nowhere. Would you agree? Yeah. The same goes for a cardiac patient. Sometimes they need to be scared into stopping eating fried foods every day, or to get out and go for a walk to strengthen their heart. Sometimes they're an immovable object and they need to be smacked with some honest talk. And sometimes a more drastic level of communication needs to happen to guide somebody closer to taking better care of themselves so that they're acting preventatively before things happen, rather than waiting to develop a more severe disease process and then being forced to treat it reactively. This is a good scare, and a good scare can be loving. It can come from a place of being helpful, and it can literally save somebody's life. Now, let's talk about bad scares, unhealthy scares, if you will. Bad scares, in my opinion, come down to typically clinic-centered, doctor-centered communication. Let me explain. There are times services are recommended for patients that are not very well backed in the research literature, if they're backed at all, and have very little hope in actually helping the patient. Yet, they are recommended anyways, mostly for the purpose of making money for the doctor and for the clinic, rather than healing the patient that is sitting right there in the office. That's the very definition of being doctor-centered. Not only are the services unethically recommended, but they scare the patients into performing these services lots of times. And this is the worst kind of scare, and it happens in all walks of healthcare. A recent research paper suggests that there are 56 million back pain sufferers in America, and out of those 56 million, only about 5% actually need any surgery. There's also more recent research showing that the most popular musculoskeletal surgeries, like back fusions and shoulder surgeries and lots of musculoskeletal surgeries that are getting done all the time, have little to zero research proving their benefit, and have never been compared in a research study to not having the surgery at all. In fact, out of all the research they could find on the most common musculoskeletal surgeries, only 64 of more than 6,735 studies, only 64 of those actually compared surgery to not having the surgery at all. And of those 64 that actually compared the two, only 9 of those were even favorable to having surgery at all. Now, I've had patients tell me the craziest things that have come from surgeons' mouths with regard to their future. Again, it's not a question of if you're going to have surgery on this. It's a question of when you're having the surgery. And I think they just teach them that line in school, if I'm guessing. But let me add to the discussion here that the American College of Physicians now recommends the following as first-line therapy for low back pain for any duration. Spinal manipulative therapy. Chiropractors do that. Exercise. Evidence-based chiropractors make exercise a big part of their practice. Massage. Many chiropractors either employ massage therapists or do soft tissue work themselves. Acupuncture. Many chiropractors employ acupuncturists, as do we, or they do the acupuncture themselves. Heat. Basically, all chiropractors have some form of heat. Ours is moist heat, and it's great. Low-level laser. Many chiropractors, if not most chiropractors these days, offer cold laser or low-level laser. Cognitive behavioral therapy, Tai Chi, and yoga. These are all things that should be tried and failed before progressing to medication, then to shots, then to surgery. Either the medical field is yet to be aware of these new guides coming from their largest organizations, or they are willfully ignoring them. I don't know the difference, probably a combination. Turning focus away from the medical field for just a bit, what about the chiropractic profession, my profession? Do chiropractors scare their patients as well in order to get them to do what they want them to do? Well, unfortunately, the answer is a big yes, indeedy. In fact, I think most professions have these sorts of professionals in them. But I'm going to give you some examples. First, though, I want to share some thoughts on current guides with regard to communications in the healthcare with your patients and current guides on the treatment. We know a lot more about communication than we knew just 5 years ago. We're learning that our words matter and that communicating properly can really have a big impact as to whether a patient eventually resolves and gets out of pain. We need to communicate hopefully and optimistically. We need to communicate in a way that gives the patient confidence in their future and in their ability to get out of pain and move forward with their life. And not only that, but we are also recommended to teach the patient at home self-management strategies rather than creating a feeling of dependence in the patient, being dependent on the clinic or being dependent on the doctor. We want them to be dependent on themselves. When a patient is empowered and given the confidence to self-treat like that, well, it makes a huge difference down the road. Now, to the examples I mentioned, I have had patients relay to me the most disturbing things that were told to them by other chiropractors. And again, this goes for the medical field and chiropractors. We're just talking about chiropractors specifically right here. But one of the most common things I hear is some variation of this statement right here while reviewing x-rays with the patients. Quote, "You might only be 32, Mary, but looking at these x-rays, it looks like you have the back of a 70-year-old. I'm real concerned about this. We're going to need to see you every other week for the rest of your life to keep this from getting any worse. It's already out of shape." Okay, first of all, no 30-something has the back of a 40-year-old or a 50 or a 60-year-old. They just don't. Secondly, that type of communication puts doubt and it fosters a lack of confidence in the patient that they can recover. It also creates dependency on the doctor and the clinic in the mind of the patient. Every other week for the rest of their lives. Thirdly, this type of clinic typically does not offer at-home or self-management strategies because they're clinic-centered, they're doctor-centered, and they want the patient visiting regularly. Patients don't attend regular appointments when they're taught to self-manage their conditions at home, right? Another common strategy is to tell patients that the curve in their neck is reduced and that the only way to ensure health long-term is to fix that curve. And I'll be honest here, is it more ideal to have a great curve in your neck? Of course it is. Absolutely. I'd much rather have a great curve in my neck than have it straightened out. Absolutely. But I'll also be honest with you when I tell you that current research, including longitudinal studies over a long amount of time, 20 years as a matter of fact, show that a lack of normal curvature in your neck is well, it's pretty normal, and it's probably not all that problematic in the long term. Still, we commonly hear chiropractors recommending 50 visits, 70 visits, and even 100 visits or more over the course of just a year or so in order to try to improve this curvature. We've seen bills for this type of treatment up to $5,000, up to $10,000. That's a lot of money. This comes with a lot of unnecessary x-rays as well, a lot of dependency on the clinic, and a lot of adjustments. Plus, the patient thinks they're not normal. They think that something's really, really wrong with them when, in fact, they're really pretty normal. In addition to the wrong messages being sent, a lot of adjustments like this have the potential to actually compound any issues that may have been going on. The more and more segments of the spine that are moved, especially 70 to 100 times in a year, the more and more those segments begin to loosen up and start moving on their own. To be clear, the spine likes stiffness, strength, and being tight. If the bones in the spine are loosened up too much and too often, well, there's a potential to create more movement and instability in that region. And that has the potential to create more discomfort and eventually possible chronic and long-lasting pain, which is completely the opposite of what they're trying to accomplish, right? Now, that doesn't mean people should be scared of going to the chiropractor. Not at all. In fact, I really believe every person should go to a good, evidence-based, patient-centered chiropractor when they have a musculoskeletal issue. There's also research proving the benefits of a preventative schedule, preventative visits throughout the year to keep from developing issues down the road. I'm just saying 50 to 100 visits in a year in $5,000 to $10,000, it's probably overkill and likely unnecessary for many, if not most. The last issue I'll talk about here is the claims of immunity on the part of some chiropractors. The claim being that if a patient and their family will visit their chiropractor every 2 weeks for their lifetime, well, they don't need to ever be vaccinated because these regular adjustments will boost the immune system and they'll never get sick. Vaccinations are a very personal issue. Some people are for them, some people are against them. That's not what I'm getting into here. What I'm getting into is being told that regular adjustments will boost your immunity so that you don't need vaccines. It's kind of a separate issue from whether you're pro or anti-vaccine. Now, there has been some research I've heard of that suggests a slight immune boost from a spinal adjustment from a chiropractor. But the guess is that a punch in the face would provide a similar boost in immunity as well. Is it likely that visiting a chiropractor regularly throughout the months and years through your life provides immunity to viruses? Is that likely? Well, the experts in the field, the researchers, have said that it's very unlikely, and that the vast body of the research literature, it just fails to support that. It can't support it. I'm not saying it doesn't work. I'm not saying that, but research doesn't prove it. When we look at the claim critically, again, from a communications aspect, this sort of thing, once again, sets up dependency in the mind of the patient on the doctor or the clinic. Dependency for life. Good for the doctor and the clinic's finances, bad for the patient, especially when we once again consider frequent adjustments and the potential for creating spinal instability as a result of them. Not all irresponsible communication is unethical or immoral or is meant to be harmful to the patient. Sometimes practitioners simply just haven't updated their full understanding of the biopsychosocial spectrum of pain and the resolution of pain and the part that the cognitive aspect of everything plays in that. Good scares help patients snap out of it and get their lives together in a positive direction. When a little good scare causes a patient to take better care of themselves to avoid pitfalls later in life, well, nothing negative can come out of that. On the other hand, bad scares can take advantage of patients emotionally and financially and can cause long-term issues for the patient and scar patients physically, emotionally, and mentally for a lifetime. Make sure that your medical or your chiropractic practitioner is communicating responsibly, optimistically, and in an evidence-based, patient-centered way. When that's the case, the patient is almost always the winner. If you're watching this on YouTube, do the things like comment, subscribe, and share, won't you? If you're watching on Facebook, be sure to like, comment, and share. All of it helps us. Again, I'm Dr. Jeff Williams with Creekstone, right here in Amarillo, Texas. If you're from our area or you're going to be passing through and you need to be seen, please call us at 806-355-3000. Let's get you on the schedule. We would love to help you. Until next week, be safe. Take care.